Good day and welcome to Kalusugan ay Karapatan. Good day, Dr. Lily.
Good day, Dr. Manchit. It is nice to see you again. I also would like to greet our viewers who have been consistently watching Kalusugan ay Karapatan. I hope they will like our topic for today, HIV AIDS. The right to be informed about HIV/AIDS will make us have a clearer understanding of its nature and the people who are inflicted with it.
First, Dr. Lily, we should tell our audience what the acronyms HIV and AIDS stand for. HIV is Human Immunodeficiency Virus. If it is left untreated, HIV can lead to the disease AIDS, which stands for Acquired Immunodeficiency Syndrome. What is frightening, Dr. Lily, is that unlike some other viruses, the human body cannot get rid of HIV completely. So once you have HIV, you have it for life.
And I understand that to date, there is no effective cure for HIV. However, according to our experts, it can be controlled with proper treatment and medical care. HIV can be controlled. We really need to have information on how this can be prevented. Health information and promotion is indeed very much needed. According to research, there is a medicine being used to treat HIV, and it is called antiretroviral therapy, or ART. If taken the right way, every day, this medicine can dramatically prolong the lives of many people with HIV, keep them healthy, and greatly lower the chance of transmitting the virus to others. At least, the good news that everyone has the right to know, Dr. Manchit, that today, a person who is diagnosed with HIV, treated before the disease, is far advanced, and stays on treatment can live nearly as long as someone who does not have HIV.
So let us get more information about the disease through our resource persons. I would like to thank them all for being here despite their very busy schedules. Let me introduce first Dr. Edsel Salvania. He's an expert on infectious diseases at the Philippine General Hospital and director of the Institute of Molecular Biology and Biotechnology, National Institutes of Health, UP Manila. Welcome, Dr. Edsel.
Thank you, Chancellor Manchit.
Welcome.
Then we have on my right, Dr. Marisa de Guzman. She is a behavioral psychiatrist at the Department of Psychiatry at the UP College of Medicine and the Philippine General Hospital. Welcome, Dr. Marisa.
Yeah, thank you very much for the invitation to join you.
And of course, we are happy to have Dr. Lawfred Hernandez, a PhD, a medical anthropologist, and associate professor at the Department of Behavioral Sciences, College of Arts and Sciences, UP Manila. What I'm interested to know from him is, how come, Dr. Lawfred, HIV/AIDS has been associated with gays or male having sex with males and sex workers? But we will go into that later, Dr. Manchit. Please, shoot the first question.
So let me start by asking Dr. Salvania, you can tell us what is HIV/AIDS, how it's diagnosed, and what is the treatment?
Well, HIV and AIDS are two different things. So HIV is a virus, as has already been mentioned, and AIDS is a disease that you get if you have the virus, and about 8 to 10 years down the line, if you do not get treatment, you develop what we call full-blown AIDS. Now, full-blown AIDS is where your immune system is so bad that diseases that normally your body is able to resist can actually kill you. Diseases like tuberculosis, like pneumocystis pneumonia, which is really just floating around in the air, and we inhale it all the time, and it doesn't do anything to us, that can kill somebody with full-blown AIDS. And in terms of the lifespan of somebody who has full-blown AIDS, if they do not get treatment, by the time they get full-blown AIDS, they will die in 6 months to a year. in terms of diagnosing HIV, so what does a person who has HIV but no AIDS look like? You can't tell. It's not something that you will be able to look at someone and say that person definitely has HIV. And so it's very important that the testing is done, and the testing done before you show signs and symptoms of full-blown AIDS. And this is done with a blood test. There's a screening test that is done, and if the test is positive, then they do a confirmatory test. And then at that point, you can basically avail of the treatment for free from the treatment hubs that the Department of Health has. So the nice thing about treatment, as has been mentioned, if you're on treatment with antiretrovirals, you can live a normal life. If you start it very early, you restore life expectancy. So we say that you actually die with HIV, not of HIV. And the last piece is that if you're on treatment and your viral load is suppressed, you do not transmit HIV. So the new slogan right now from the International AIDS Society is undetectable equals untransmissible. So in summary, HIV is no longer a deadly disease. It can become a chronic disease that is controllable. And has been mentioned, there's still no cure. But if someone is diagnosed early enough, then they are going to live more or less a normal life, and they will not make anybody else sick.
So Dr. Etzel, so who needs the test? Who needs to be screened?
Well, I know Dr. Lawfred will talk later about what constitute risk factors, but remember that this is a disease that is not detectable for 8 to 10 years without a blood test. And so I think it's important to think about how people get HIV. Most of the HIV in the Philippines is still by sexual transmission. So if you think about it, if you've had a partner in the last 10 years and you can't say for sure that they didn't have sex with anybody else and you don't know if they have HIV, then anybody should be tested. In fact, the Centers for Disease Control in the United States recommends that anybody who is the ages of 15 to 65 should get an HIV test. And the reason is that 40% of patients who have HIV do not recognize that they have risk factors. And so really the best way to deal with this, because it's something that's controllable, and from a public health perspective, diagnosing and putting people on treatment decreases or eliminates the risk of transmission, I think that everybody should have an HIV test at least once in their life.
So, is this widespread in the Philippines?
So HIV...
Do you have statistics to tell us? Yes,
all right. So
Doctor?
HIV in the Philippines is an interesting story because early on, AIDS epidemic started about 30 years ago. Most of the cases started in Africa. There's 20 million cases in Africa. But while the rest of the world was having lots and lots of HIV cases, Thailand has almost 1 million cases, and our neighboring countries do have them. The Philippines was strange. It didn't have. It had very, very few cases, despite the fact that our STD rates were similar to the other countries around us. So it's not that we weren't having sex. We have the fastest birth rate in the world, so obviously Filipinos are having sex. But there was an interesting statement that circumcision actually decreases the risk of transmitting HIV. And we know that 92.5% of Filipino men are circumcised. And so in heterosexual transmission, it actually decreases the risk of contracting HIV by about 60%. So that kind of protected us. In the end, though, our luck ran out. It finally caught up with us. But because the world has been doing so much in terms of HIV, we're seeing the trend for most countries, including those in Africa, in the United States, in Europe, going down, while in the Philippines, it's going up. Yeah. So since 1984, while we were keeping track of all these cases, we have about 42,000 cases. Until now, it's very, very small. But if you look at the actual number of cases per day, 10 years ago, we only had 1 case a day. And now, we have 30 cases a day. So that's over 3,000, that's a 3,000-fold increase. While the world has gone down by more than 50%, we've gone up by more than 3,000%.
Are there 30 new cases every day?
Yes. there are 30 new cases. There were 968 cases diagnosed in March of 2017, which is the latest statistics that we have. And just to to compare it with what it was back in the early 2000s, there was maybe one case every 2 days. The other piece is that while early on, before 2006, we saw half of the cases were imported from returning overseas workers and the other half were local transmission. After 2006, we saw a major spike in the number of local cases. And this was coincident with a shift in the genotype of HIV, which was actually demonstrated in our own National Institutes of Health. We saw that the genotype of HIV had changed from type B, which is the American type of HIV, to the Thailand type of HIV, which we think is more aggressive, and we did see that. People had lower CD4 counts at presentation with AE and is more likely to fail treatment.
So in other words, whereas we were seeing the American type at the beginning, we're now seeing the Asian type, and as you said, the Thai type.
Yeah, the interesting thing about it is there is some literature that suggests that this was with the closure of the American bases. That's why there were less American types, and then the new type actually got into our community and then spread rapidly because people have sex.
So Dr. Lawfred, talking about risk factors, what are the risk factors for our Filipino population?
In the case of the Philippines, the primary mode of transmission is still sexual intercourse. And when we say sexual intercourse, it's a unprotected penetrative sex. Based on the figures that was initially given by Dr. Edsel, is that since 1984, the very first onset of HIV in the Philippines in 1984 to 2017, we have 42,000 cases, and out of which 88% are really men being HIV positive. And out of the 88%, about 53% are doing male-to-male sex, unprotected sex. So then again, it's still sexual transmission. It's still the mode of transmission in the Philippines compared to other countries like Indonesia. It's in IDU, injecting drug use, is the primary source or primary transmission in terms of HIV infection. So we can see different countries, but predominantly all over the world, it's still sexual, unprotected sexual transmission.
Let me follow up. Yes. Dr. Menchut, looking at the genotype and looking at the methods of transmission, is there a relationship between this genetic variability and method of exposure of transmission? I know very well that in Malaysia, it is not through sexual intercourse or unprotected sex, but it's via ITE. Yes.
Injecting drug
use. Is there a difference in the genotype and the method of transmission?
Absolutely. Actually, if you look at the increasing number of IV drug users in the Philippines, and this was mostly a cohort from Cebu, most of them had genotype B, and almost 90%. But in MSM, it's almost all AE, maybe about 75 to 80% CRFAE, which is the Thailand type. And we think that that's also because the B type is older, and so you have much more efficient transmission. So for instance, if you had sex with someone heterosexually, your risk of getting HIV is about 0.3%. But if you inject, it's about 60%. So if you're there first, like the B types, then you're more likely to spread in that sense. But you can look at it from that standpoint. But we're also seeing, again, at the National Institutes of Health, where we're now doing whole genome, next generation sequencing of HIV viruses, we're actually seeing recombinants of B and AE at the same time. Because if somebody gets super infected, their viruses can mix within the host cells and give rise to new variants.
And that would also be the same like, IDU being a sex worker at the same time adds up to that genotyping. That's what Dr. Edsel is trying to say to us.
Let me pursue an interesting question. You said unprotected sex. Protected from what?
Protection from the virus, the being getting transmitted between two couples. let me start off by saying by 2 couples, but in the
But
Philippines,
couples are male-male?
now in the Philippines,
Can you explain that?
now in the Philippines, we are predominantly, the transmission right now, the number of cases of HIV are really among men who have having sex with other men. But by definition, let me start off by the definition, what is an MSM? MSM are really, as it is, men having sex with other men. They are not technically gay men, and they're not technically bisexual man. It so happens that a heterosexual male would like to experience sex with other men, and therefore not really separating themselves or not even identifying themselves that they're gay men, especially if there's consummated sex between 2 men. So MSM is a new term created by the WHO way back in 2006 when there was an increase, sharp increase of MSM globally. So they said that when they approach the HIV positive and they would gender identify themselves, they say they still have heterosexual in spite of the fact that they had 10 or more than 10 unprotected penetrative sex with other men. So that's the reason why WHO created the term of MSM.
MSM. And that is also being used in the Philippines?
Yes, yes, ma'am. It's being used in the Philippines, and as I told you, statistically, we have more than, right now we have more than about 70% of our cases, or better yet, in the 30 new cases a day, you could just imagine about 70% are really MSM.
Okay, so, I mean, which brings me to the question, I mean, what's behind the Filipino psyche right now, Dr. Marisa? I mean, maybe 20 years ago, even 10 years ago, we don't talk about MSM, but now it seems like it's a byword, and when you have a problem with HIV, what happened to the Filipino culture and the Filipino psyche, Dr. Marisa?
Well, you can say that there is a multifactorial causation to the development of HIV/AIDS. For one, when you talk about risky behavior, it's a behavior where there is a tendency to engage in activities that they know may be harmful or dangerous to them. And some get excited about it or find pleasure in it. Now, when you talk about high-risk sexual behavior, then you're referring to behavior that give rise to sexually transmitted disease, unplanned pregnancies, or being engaged in a sexual relationship before knowing or before they are mature enough to know what makes a healthy relationship. So this is seen in early adolescents and young adults, especially when they engage in sex before the age of 18. So that's when they have their, what you call their sexual puberty of unprotected sex. Okay, that's one factor. The second factor are family factors, environmental factors. No? Oftentimes, if they come from an environment when there is high stress, alcoholism, drug abuse, domestic violence, physical violence, and neglect, these are the risk factors that can contribute to unhealthy sexual behaviors among young adolescents. And oftentimes, we don't recognize, this is family interventions is not part of the, hopefully, the realization is that family interventions should be part of the HIV/AIDS prevention program. So those are the reasons.
So Dr. Marisa, you're saying that the young of today
Yes.
tend to favor high-risk behavior compared to the adolescents of the past?
Yes, because of their exposure from what they see in social media, you know, from what they see, from their exposure in, in what they read in pornography, which is high on the rise. So the engagement with, and not only with MSM, no, but we are talking about multiple sexual partners. And one of the risk factors is that many of these are engaged in sex out of money or because of they need drugs.
Okay,
so that's the sad part.
I have a question, but I don't know who to ask. But when a person discovers that he or she has HIV or even AIDS, what happens to the relationship? I mean, I know you've handled thousands of patients right now. Maybe I can ask all of you, and you might have different perspectives on that question. What happens, Dr. Edsel?
Yeah. So I think that the Philippines has a very strong family unit. And so it's been one of our bright spots, you know, if there is a bright spot in HIV, that I think that compared to, say, the United States or Europe, if you can get the patient to tell his family, or at least one of his loved ones, the family support has actually been pretty solid. Blood is still thicker than water in Filipino society. And so while, you know, people are very prejudiced when it comes to people that they don't know, I mean, you just look at social media, how vicious the attacks can be. When it's one of their own, they actually close ranks. So that's one of the things that I try to, when I talk to somebody who we just diagnosed with HIV, or we're thinking about doing the diagnosis, and it comes back positive, and you tell the patient, you know, this is something that is really difficult to do on your own. And so I encourage you, sinong best friend mo sa family, maybe at least start with that. Or if you want, I can help you disclose to your parents, because I've found that at least those people who disclose to, very importantly, their mom, kasi sobrang kulit nung nanay. They're the ones who make sure they take their meds, who bring them to their appointments, who constantly nag them. Take your meds. Don't give up. And so, in my mind, at least from the Filipino standpoint, it's very, very important to get the family involved very early. And then that actually plays into the survival of our patients.
But what about a couple? I mean, you know, we talked about heterosexual, wherein they still probably are still married. Does something happen to the marriage because of this information, Dr. Marisa?
Well, in terms of doing couple therapy, when one has infected the other couple, the other spouse, because of engagement in how do you call that, sex outside the marriage, usually there is, in the initial phase of anger, there is frustration, denial, and fear. But eventually, because of they recognize that this is an illness, and a chronic illness for that matter, the Filipino compassion surfaces, no, and they want to take care of the other spouse, even if they themselves know that they are also infected because of the sexual behavior, promiscuous sexual behavior of the other spouse. So, out of compassion, there is the desire to take care of the other couple. And my experience is that they do not want the children to know if they are both found to have HIV/AIDS positive.
May I pursue that behavior? I'm interested to know about husband and wife relationship. And they're expected that they are very faithful to each other. Would the husband be really telling the wife, I am infecting you, or is that possible?
No.
I
It's
think
usually discovered
husbands-
in a very serendipitous way or accidentally, because you have an illness that is not a chronic illness. So the spouse brings the other spouse for a medical checkup, and when they do an HIV/AIDS and it's found to be seropositive, then of course comes in the question, where did you get it?
Where did you get it?
So,
Yeah. Will
so
they
it comes
tell to
out.
each other?
Huh? It comes out, well, usually in OFW workers, it happens that they get it abroad, no, because they've been out for many months, and maybe they've had sexual encounters, random sexual encounters in the places where they go. But then locally, we also have found patients who've had contact in parlors, massage parlors, or may have had because they tell me my husband just goes to massage. He tells me, it's all right, I go for massage, but then the massage turns out into a sexual encounter.
There's a lot of layers to that. This is my bread and butter. I'm an infectious disease doctor. Half of my patients are STD patients, not necessarily HIV patients, but just people with gonorrhea and chlamydia. So there's very many layers. You mentioned OFWs. A lot of the times, it's the man, and the woman is really dependent on the man for money, and so they rarely break up. Very rarely, as a matter of fact. But the other thing is that it takes me a while to convince the guy to tell the wife, Because usually the easiest way is to say that, well, this is going to be like ping pong. If I treat you, you don't tell your wife, she's going to infect you again, and then it's going to go back and forth, back and forth. And number two, I have to involve an OB-GYN because I can't do a pap smear on that. The second is a situation where you have the man is infected and he got it from another man and got the wife pregnant. So now you have two situations. You have three situations. The first situation is that the man is unfaithful to the woman with another man. Number two is that the woman may have contracted it. And number three is that the baby may have contracted it. And those are very difficult situations. In the three cases that I've had, the woman knew that the man had other men. So, parang tanggap na nila. I mean, one of them worked in a parlor. I mean, what are we saying in that sense? Only one of those three women was infected. And we were able to prevent transmission to the child by putting the woman on treatment. But it's a very interesting dynamic.
Yeah, and to add on to that, since our researches with UP Manila, NIH, AIDS Study Group, with the Department of Health, in 2004, we found that discretion is really a problem among Filipinos, them having HIV. So they cannot easily declare. In the case of MSM, it's a double-edged thing because they would rather not declare their HIV status because they don't want to declare their sexuality to their families. Because normally most families would frown on their sons being gay or bisexual, and therefore they would not prefer telling them that they are gay or bisexual. It's easy for them to tell their family about their HIV status, but not their sexuality.
Can we talk about the age of the affected men?
As of the statistics now, out of the 37,000 men, which is about that figure comprised the 88% of the total HIV. 53% are of the 88%, 53% are HIV positive men, MSM, ranking about 31 to 35%. So relatively high. Age would be, the 35% would be 25 to 34.
Do we have younger age group,
Yes.
MSM?
Yes, that would be
Oh, that's
15 to
interesting.
20,
Can you tell us?
23.
Yeah?
15 years old to 23.
15 years old.
The youngest,
The youngest.
the youngest reported case in the Philippines.
No, we got still the youngest. We got lower. Well, the youngest right now is around 11. And so far as I know, it's 11 and 12 years old.
There's also mother-to-child transmission, and that's happened 4 times, I think, last year. And so that's, if you're not able to start the mother on treatment before they give birth, that's an issue. The median age right now is about 28 years old.
Yeah.
And that's actually gone down from about 32 before.
They're getting younger.
Yeah, my youngest patient with full-blown AIDS was 18 years old, which means he contracted it, in his teens.
I'm
because 18
counseling 11 years old right now.
Yeah.
So
And then that's probably
very young.
either that's probably
Yeah,
child
from
abuse.
the
That's child abuse. Yeah.
So how many of these couples are married?
The figures that I said is only for MSM.
Okay, MSM. Okay.
So because the bulk of the majority of the infection is really from the MSM. So you could see an MSM that is as young as 11 years old.
Okay, Dr. Marisa.
Yes. So how to explain that? Well, we're looking into family dynamics, and what we're finding out now is that the lack of acceptance of children who turn out to be gay, what brings up internalized shame and low self-confidence in the child, and that pushes them also to unhealthy sexual behavior. So that's also one of the problems. There is a need for, and I agree with the suggestion of Dr. Saldana, that there is a need for gay and lesbian children to be open about their sexuality to their parents. No? I think family bonding and open communication is necessary for children to prevent unhealthy sexual behavior, because if a child knows that the parents care for them and have time for them, then there is no reason for them to go into risky sexual behaviors or to go into contraception at a very young age.
Let me pursue that risky sexual behavior. I'm in the field of public health, and it is very important to me to know, and perhaps the viewers to see and understand. Let's go to sexual behavior. Is this the normal sex, or what kind of sexual behavior are we talking about?
Well,
Can you elaborate on this? This is interesting.
Well, sexual behavior is always evolving through time. The sexual behavior about 20th century is totally different from the 21st century now. The main reason are the following. Number one, there are more sexual access among the adolescents right now. Being millennials, they're very open to to internet and open highway of information. Second, not only access, but also they can also have free sex all the time, meaning to say with group of friends. Gone were the days whereby there's a knight in a shining armor and really will date you and eventually you get married and that's the time that you want to have sex. Not now. Based on the research conducted by the Population Institute of UP, the Young Adult Fertility Survey, the sexual debut among boys is around 13 years old. And out of 10 they had sex, 10 penetrative sex at the age of 13 years old. Out of 10 boys, 8 are not using condoms at a tender age, and out of the 8 boys who are having sex already, 4 of the 8 are doing it at the same time with other boys.
So, I will pursue my question because I will ask you something about campaigns. If I kiss you right now and you have the virus, will I get it?
No. No, you cannot.
Even I kiss you for more than 10 minutes, I will not get it.
No, not
How
at
will
all.
I get it?
Well, you need to have about how many gallons, Dr. Edsel, of saliva in one sitting before you could possibly have that kind of virus already.
Maybe we can talk about risk. Okay, so for heterosexual risk, heterosexual sex, the risk is about 0.3%, one sex act in somebody with HIV who is not on treatment. For anal penetrative sex, if you are anal penetrative versus anal receptive, it's anywhere from 10 to 15 times higher than the 0.3%.
What is anal penetrative and anal receptive?
So
I think we should be educated on
Sure,
this.
absolutely.
Yeah.
And understand that it is not just MSMs that engage in anal sex. Okay, so there are females who engage in anal receptive sex. They can't do penetrative because they don't have a penis. So in terms of the highest risk, it's still anal receptive sex. Right, because if you get the virus in the semen and it goes straight into your rectal mucosa, it has the most number of targets, dendritic cell targets, CD4 cell targets that it can go through. In heterosexual sex, especially if the male is circumcised, there are less dendritic cell targets on the glans penis because it's keratinized. So that's one of the ways that circumcision decreases the risk of getting HIV. For oral sex, there is a lower chance, but it's not zero either. And so it's important to understand those risks in the context and also how many partners. For instance, in our HIV clinic in PGH, the average number of partners is about 100.
Okay.
Yeah, so 100 partners.
Okay. So what is clear is that prevention of no sex is the best, or you keep to one who is clean and not affected. But I'd like the viewers to understand that there is treatment. You said earlier that anybody is at risk, but if I were a person who would like to know, am I at risk? When should I go and have the test done?
So for anyone, aside from doing it as part of your usual thing, so the things that we've identified, aside from risk, most at-risk population, men who have sex with men. By the way, let me just give you the statistics for Luzon, Visayas, and Mindanao, because a lot of people think this is a Manila problem. So for nationwide MSM prevalence, it's 5.8%. For Manila, it's 7% in MSM. 7% of MSM in Manila are HIV positive. For Cebu, it's 14%. and for Cagayan de Oro, it's 9.8%. So if you're MSM, you better get tested. The cutoff for cost-effective screening is 0.1% in a population. So if you find a population where the prevalence of HIV is above 0.1%, everyone in that population should get tested. So some of the studies we've done at NIH as well, for TB patients, because a patient who has HIV has a 24 to 28-fold increased risk of getting active tuberculosis if they're HIV positive, then we did a study in PGH where we tested 300 patients with TB, regardless of risk factors. 3.7% were HIV positive. So that's more than 0.1%. Test all your TB patients.
Okay, but outside of the MSM, would you advise that one be screened or not worry if they are not having any sex or they have protective sex? Should not worry.
So for healthcare workers, I would advise all healthcare workers to get a baseline test, because how many of us have not gotten a needle stick? I mean, you think about that, right? So at the very baseline, and anytime you have a new partner or a new needle stick for that matter. In fact, we are coming out with guidelines where even surgeons can continue to practice even if they have HIV, because we talked about undetectable equals untransmissible. So it's no longer an ethical issue.
Dr. Edsel, I want to spend some time on treatment because you said it's free. So maybe for the viewers who are probably positive or are worried, can you tell them what the government is doing as far as treatment is concerned?
So the government was really forward thinking with this, because there is a PhilHealth package. The first PhilHealth outpatient package actually covered HIV, and it gives 30,000 pesos a year. And the cost of treatment, because we get our medications through UNICEF, and so it's very low, it's only 7,000 pesos a year. And so there is money left over for CD4 counts, for viral loads, for all the other health maintenance things that we can do. And our treatment for HIV right now is one pill once a day, which is just as good as anywhere else in the world. And it's exactly the kind of treatment that we know will restore life expectancy if it started early. We did another study. We looked at our HIV patients, more than 1,000 HIV patients, looking at what factors decrease or increase the risk of dying. And we only found two. The first was that if you get tested and found to have HIV at a CD4 count of less than 200, then you are 6 times more likely to die. What does that mean? If you get tested early, you're less likely to die. The second is that if you're on antiretrovirals, your risk of dying goes down by 2/3. And so those two things are local evidence that tells you that ARVs work and that you should actually get tested early.
So how do you get the treatment? I mean,
To add to what Ed said, and regarding the treatment, ma'am, the Department of Health has identified 21 sentinel sites in the country. When I say sentinel sites, this is the sites where there is more than 0.1% prevalence, is what Dr. Edsel is saying. So all those 21 sites all over in the Philippines, and they've got treatment hubs. And people can go to those treatment hubs to have themselves tested. 21 treatment hubs in the country.
so how does it, I mean,
I'd like to
yes.
because just because they're into antiretroviral therapy doesn't mean that it guarantees that they're not going to take it again, because they have to include behavioral modification, maybe lifestyle changes, for them to go into safe sexual practices. If not, there is a risk again, because there is an increased risk, especially for higher risk for those with HIV transmission, for those who are HIV positive. Why? Because they can go into prevention fatigue, where there is a high tendency to relapse, to go into unsafe sexual practices, because it's a behavior. I mean, and that change of behavior needs time and therapy and family support and other support systems, acceptance in the community, fighting against stigma and discrimination, so that they stay, they continue with treatment compliance, which includes regular antiretroviral therapy plus behavior modification or lifestyle changes.
But
So it's not just
yes,
drug use.
I will ask something also. I need your answer and I need your answer. given the incidence of HIV, is this infection cutting across different professions in the Philippines? I think it would be nice to know that.
Well, HIV doesn't know any profession at all. HIV can be greatly affected by anyone. I mean, especially the population.
My question is, yes, no one is resistant. Everyone is susceptible if you're engaged in some of these sexual practices. But I was informed by a friend of mine, a doctor from the National Capital Region. She said, Dr. Lily, you must know, even doctors are infected now, nurses and health professionals. Do we have figures on this?
So in our HIV clinic in PGH, which has about 2,000 patients right now, the number one profession is office workers. Number two is call center workers. And number three is healthcare workers.
Healthcare workers.
Yes.
So it's the prick, that's why?
No.
It's the sex.
Sexual transmission.
Okay.
Sexual. But of course, we would like to discourage that notion that HIV can only be seen in this particular group of profession.
Yes.
We would like to avoid that one because, of course, to protect also the people who are HIV positives from those professions. But you know, generally speaking, regardless of the profession, economic status, even gender orientation, HIV can be transmitted.
Yeah,
For
those
as
who don't
long as-
abstain from sex.
Well, the only thing right now,
Sexual-
and the government,
Yeah.
what we're doing right now is really behavior interventions. We learned our lessons way back in 1984 when USAID dropped boxes and tons of condoms in the country
Yes.
without even explaining to us how to use it.
How to use the condom.
So everything is medicalized in terms of HIV, but you have to look at the social fabric of the disease, meaning to say from the family, individual, family, community level, because we couldn't be clueless because number one, Filipinos, they have very low condom use statistically, so they don't like condoms. When in a research we conducted in 2008
Who
and 2010,
do not like the condoms? The male or the female?
the males.
The
They don't want to
males.
carry condoms and do not use condoms at all. When we had the researches in 2004 and 2010 and 2011, among the overseas Filipino workers, they would always tell me when I asked them, "How come you're not using condoms even to your wives after after your contract with as an overseas Filipino worker?" They would say, "Sir, how can you possibly eat candy when the wrap is on?" So they would always tell me that you won't savor and enjoy candy with the wrapper on. So you could just imagine. So therefore, insofar as the UP Manila NIH Men's Health Study Group, we want to emasculate their masculinities because second reason for the transmission is that men dictate whom to have sex with, where to have sex with, how and how many. So this is being generated by men. And you could just imagine that men dictate without even telling their wives that they're having sex with other women or men. They have the power to disclose it. And what's more, if they're going to have sex with that kind of masculine power and they have to have sex with other men who have other masculine power, that is really hegemonic in that sense. So it's really a behavior thing, what we're saying here.
It's a behavior thing.
You know, Dr. Lily, I think we need more than one session or episode for this.
Yes.
But, you know, I still want to just emphasize that we can prevent it.
Yes, we can prevent
It's
it.
treatable. It's a family affair. And it's because of the Filipino culture that we're able to, you know, survive this time of tragedy probably in the family. But it's different from before because there's hope. But I do want to get a message from each of our guests, your parting words and message to the audience. Definitely we will have a second episode. I don't think we've covered all of the topics, but I'd like to start off probably with Dr. Edsel.
So I think it's important for people to understand that this is a survivable disease, number one. It's not yet curable, but it's survivable. And number two, it's preventable. And number three, a lot of that prevention and a lot of that survivability depends on getting tested early. Because the later it is, in fact, if you end up in the hospital with an opportunistic infection like pneumocystis pneumonia, your mortality, your 1 month mortality is actually 50%. If you get intubated, you're put on a ventilator, your 1 month mortality is 90%, as opposed to never getting AIDS if you get started on treatment early. So just to understand those two things, there is a personal benefit and a huge public health benefit because you're not going to transmit HIV anymore. I think that should move people to get tested, not just to protect themselves, but also their loved ones.
Dr. Lawfred, I will give the psychiatrist the last say on this one.
I would like to echo what the Department of Health is doing in terms of HIV, and based on the 6th AIDS medium-term plan, which is 2017 to 2021. We hope by the end of 2021, we could have zero HIV and zero AIDS death. That is the slogan right now of the Department of Health by the year 2021. And how can we do that to achieve that zero level? Is the prevention. I would like to encourage our viewers also that get yourself tested early. There's nothing wrong. You won't be stigmatized or even discriminated upon when you get your HIV test early on. So prevention is really the key word here. It will take some time really for us to have that level of maturity in order to have a good prevention work, but we need to start somewhere.
Now, Dr. Marisa.
So to summarize what Dave just said, prevention is a cure for something that has no cure, and knowledge is prevention for HIV prevention. And well, definitely there are two things that we would like to request for government support is that, as they've requested, HIV testing for everyone, but that cuts across all levels, all sectors of society. As early as possible, even better. And second, that once you're found to be HIV positive, seropositive, well, you can get help, no? And that help is not simply limited to antiretroviral therapy, but as well as support, support from the community through therapy, through support groups, through family psychoeducational programs. In that way, this prevention is something that can be extended not only to oneself, but for all the members of the family and the society in general.
There you are, ladies and gentlemen. We hope we learned a lot about HIV/AIDS, Kalusugan ay Karapatan. Though this episode has upheld the rights of our viewers to information and what they are entitled to enjoy to live a happy life. Let us thank Dr. Lawfred, Dr. Marisa, and Dr. Elser, our expert HIV people with us right now. Thank you.
Thank you too to our viewers for watching and listening to us regularly. We hope that this is not the first and the last episode on HIV. Thank you so much for watching Kalusugan ay Karapatan. Remember always, we will be back. Good day.